Um, okay, thank you for having me this morning. Um, I'll introduce myself again. My name is Megan. I'm the education coordinator at AIDS New Brunswick. And today I'm just going to be talking about HIV, generally how HIV is transmitted, how HIV is treated, and what you can do to protect yourself and prevent HIV as well. So what is HIV? HIV stands for Human Immunodeficiency Virus. HIV is a virus that attacks and can weaken your immune system. Sometimes there are symptoms that people can show similar to flu symptoms, but it's important to note that you can have HIV without knowing it or without having any symptoms. And lastly, that there is treatment available for HIV. How does a person get HIV? HIV is passed through 5 bodily fluids: blood, semen, vaginal fluids, anal fluids, and breast milk. And it can happen if any of these fluids gets into the bloodstream. As well, anyone can get HIV, any age, anyone, yeah. So the main ways HIV can be passed, one is by having unprotected sex or any sexual activity without a barrier. Sharing needles that have been exposed to HIV, or other equipment used to use substances, as well as transmission to babies during pregnancy. And these are all if somebody isn't treated. So, knowing your HIV status or getting tested for HIV is important. You can have HIV without knowing it or without having any symptoms. And so the only way to know if you have HIV is to get tested. And in Fredericton, you can book a test by calling Fredericton Sexual Health Services, and that is the number listed. So now we're going to talk about steps that can be taken to prevent HIV. One is called pre-exposure prophylaxis, or PrEP. This is a medication prescribed by a doctor which is taken daily. This is for people who are HIV negative, wanting to prevent HIV, and it reduces the risk of sexual transmission of HIV. Another way HIV can be prevented, another medication, this one's called post-exposure prophylaxis, or PEP. So this is a medication also prescribed by a doctor, which can be taken after a possible exposure to HIV. And it's important to note that it's up to 72 hours after. So, starting it should start the medication as soon as possible, because there is a window of 72 hours when it is effective. And it also is very effective and reduces the risk of getting HIV. This can mostly be accessed by visiting an emergency room, because there is such a time constraint, that 72 hours. But it can also be accessed through online appointments on eVisit NB as well. And I'll pass it over to my coworker, Heather.
Thanks, Megan. Just let me know if you can't hear me. Another way to prevent HIV is always using a condom, practicing safe sex. If you have another sexually transmitted infection, then that can increase your risk of getting HIV. So it's important to see your doctor regularly and have tests done if you think you may have any type of infection.
Excuse me, could you please speak a little bit slowly, because interpreters are making interpretation. Thank you very much.
The next way to prevent HIV is to use safe injection practices. Safe injection practices mean using new equipment every time you inject a medication or use any type of medication, whether that is prescribed by a doctor or not. And when pregnant, as Megan mentioned, you can transmit HIV to baby. However, if you are taking the medications, then that will most likely, they are effective at preventing the HIV from being transmitted to the baby. The medication that is used to treat HIV if someone is positive, it's called antiretroviral treatment. This treatment lowers the amount of the HIV virus in the blood. It's a medication that is taken daily and is prescribed by a doctor. This medication, when you take it, it works in your body to suppress the virus. This means that it limits the amount of times the virus is able to replicate or grow in the body. Your doctor will do blood work on you every 4 to 6 months to make sure that your virus levels are staying low and see if the treatment is working well. And remember, it can take up to 6 months of taking the treatment before it works and your virus levels are undetectable. And we'll talk about what that means in a second. So after you have been taking your medication for 6 months, and after your doctor has done blood work to make sure that the treatment is working, if the treatment is working, it'll be considered undetectable. If their virus level is undetectable, it means that it can't be transmitted to another person. Therefore, after taking treatment for 6 months, if it works, that means that you will not have a risk of passing on HIV to a sexual partner or to a baby during pregnancy. The likelihood is low. And just to summarize, I have put it on the screen here too. So most people who take the treatment as prescribed can achieve and maintain an undetectable viral load, which means that you effectively have no risk of transmitting HIV sexually or during pregnancy. Of course, it's important that we talk to our doctors before any of this because they will know about us individually and will be able to tell us more information. I suppose I'll pass it back over to you, Megan.
Thank you, Heather. Yeah, but that's a really important part, is that if treatment is successful, there is little to no risk of transmission. As well, just generally that with treatment, people living with HIV are able to live long, healthy lives. So if anybody has any questions about any of that, feel free to ask or put them in the chat.
Yeah, thank you very much. So if someone from language groups has questions, please let us know. We will wait for a few minutes to give them possibility to write these questions, and if there are some, we will answer. Okay, thank you very much. If anyone, sorry, Lucy is asking question.
Yes, so PrEP, who is this recommended for? Anyone can take PrEP. But typically, if somebody feels that they might be more at risk. So maybe they, like we mentioned, are having unprotected sex, or maybe they, are having multiple sexual partners. PrEP, might apply in these situations. It's typically, though, people who feel that they're, more at risk, but that, anybody can take PrEP. I see another question. What if we miss the 72-hour window? At that point, like, I would still say to contact your healthcare provider, or to see, a doctor or a nurse practitioner. That way you can be, referred to a specialist, to kind of see what next steps are. It is difficult because there is that window there, and not everyone can access, a doctor's appointment within that period of time. That's why it's mostly available through emergency rooms, and things like that. But yeah, just to summarize that, contacting still, like, your healthcare provider, or getting in to see a nurse practitioner, or a doctor, would be important. And another question I see, do people need to take medication for life? People living with HIV, yes, have to. There's no cure, but there is treatment. The medication, but that also includes, seeing your infectious disease specialist, getting, regular tests to check the viral load and see if you still have a chance of transmitting that. Also, just to kind of check up on other things, depending on how long it is before you start treatment. It weakens the immune system, so getting on treatment as soon as you can is very important, because you can, people living with HIV can live long and healthy lives on treatment, but yes, it is taken for life. Yeah.
Again, thank you very much. If anyone has question and didn't ask it, in the chat we have a email for our Jing Lee, who will be able to pass this question to AIDS New Brunswick, and the recording will be available. If anyone is interested, please contact to Jing. Thanks again.